on this Saturday, October 16th, from 8 a.m. to 2 p.m. behind the Albany Civic Center for our second incentive-based COVID-19 vaccination event. During this event, you can receive your first or second Pfizer COVID-19 vaccine. And if you're a Dougherty County resident age 18 or older, you will receive a $100 debit gift card. Proof of residency is required. Are you a college student in Dougherty County? You qualify as well. Just be ready to show your valid college ID to receive the gift card. Our vaccination process is seamless with limited wait time, and while you wait, you can expect some entertainment with a live remote from JDiva with WJIZ from 10 a.m. to 12 noon, and constant music from DJ Jackson Riley with First Media Services. Drive-up and walk-up traffic are both available. We are striving for 75 in Dougherty County, which means we need to reach our goal of having 75% or more of Dougherty County residents vaccinated before we hit the new year. So join us this Saturday, October 16th from 8 a.m. to 2 p.m. behind the Albany Civic Center and be a part of Strive for 75 and help us to continue to protect our community from COVID-19. This event is brought to you by the Dougherty County Board of Commissioners in partnership with Phoebe Putney Memorial Hospital, the Department of Public Health Southwest Georgia District, and Albany Area Primary Health Care. For more information, visit dougherty.ga.us.
Good morning. I want to welcome you to our weekly press briefing with updates on COVID-19. My name is Michael McCoy, Dougherty County Administrator, and I will be moderating today for Chief Scott, our Emergency Management Director, who is off today. Please join me in a moment of silence for the lives we have lost to COVID-19 and for the families they left behind. Thank you. Now we'll hear updates from our community leaders. First, we'll hear from City of Albany Mayor Bo Durr.
Good morning. Thank you, Mr. McCoy. Have some information. I don't know if anyone from Phoebe will be here today, but you'll hear from certainly Dr. Ruiz. I think most of the news will be positive. I have some information that's also kind of academic interest, but what we'll start with, as we've discussed before, the city manager collects the testing results from almost all of the sites in town. That's Community Health, Department of Community Health, Phoebe Putney, Albany Internal Medicine, OneSource, and Albany Area Primary Health Care. There are other providers, clinics that sometimes do testing that are not reliably providing the results, but this is well in excess of 95% of the tests that are conducted in the county. Microphone? Okay. Excuse me. I was talking about the city manager collecting the test results from the various sites. These are the bi-weekly results. As you see, we know that earlier this year we were in the latter stages of what's been called the third surge. We know that the numbers were quite low from about the 1st of February until the middle of July, when we saw what's now been called the fourth surge. The number of positive tests, obviously there's going to be a correlation between the number of positive tests and the number of people who are being tested, and more people are going to be tested when there's a high rate of transmission in the community. But what we see is the number of positives peaking basically at the end of August, and throughout the month of September, we see a decline. Thank you. This is the percentage rates. It's going to tell us here, anytime you get over 5%, it's a concern, but we see again in the middle of July, after the July 4th weekend, the uptick that was anticipated, but you certainly didn't foresee this surge. What we've talked about before is they use the term, it's a pandemic of the unvaccinated. We'll see some numbers that the overwhelming number of people who are testing positive, and particularly those who are becoming seriously ill and have to be hospitalized, are unvaccinated. We saw that a couple of weeks ago with the percentage of those who had died this year who were unvaccinated. The positivity rate, as I said, you'd like it to be 0, but as long as it's under 5%, it's pretty well under control. When it got up to 22%, that is placing such a stress on the healthcare community that other services are having to be postponed or either restricted in scope. This is again the percentage we see from, when is that, 1st of March, when we had a 6% positivity rate, until July 5th, when we had a 3% positivity rate. And I think what you have here, right before July 4th, the positivity rate was so slow, there was a great deal of complacency because we had seen a flat line in the number of infections for so long. These are numbers from Phoebe Putney Hospital. Again, you're going to see that the census, which is the average number of patients, COVID patients in the hospital by week, is going to generally correspond with that positivity rate, maybe be a week behind in peaking. As of August 28th, that is, I think, the 164 was the highest census at any time since the first COVID diagnosis in March of 2020. The numbers have fallen. The most recent number is a census of 67, and hopefully we're back down on the trend to getting the numbers below 30 again. This distinguishes the admissions since the week of April 3rd, I think it's March 28th, on the number of patients who are vaccinated and unvaccinated who are admitted to the hospital. This is a graph which pretty well tells the story. Since March 28th, the percentage of patients who are admitted to Phoebe Putney Memorial Hospital with COVID that were unvaccinated was 88%. And we've got those numbers backwards on the graph. I'm sorry about that. So it's 12% of the patients who are admitted were vaccinated, and 88% were unvaccinated. That 12% also includes individuals who were partially vaccinated. Vaccination statistics, we've seen this before. These are the states, you might not can read it. The states with the highest vaccination rates, the first 5 are 5 of the 6 New England states. The other New England state, New Hampshire, is number 10. The 6, 7, and 8 Atlantic states, New Jersey, Maryland, New York, this is the percentage of people who are fully vaccinated, Vermont leads the country at 70%. New Mexico is the one state that sort of surprised on there. It is number 9. The lowest states with the vaccination, Georgia is 42. Of those states, most of them are in the southeast: Georgia, Mississippi, Alabama, Tennessee, Arkansas, Louisiana. 5 of those states, actually, West Virginia, you see, has the lowest vaccination rate. And let me basically close. I want to thank the Department of Public Health Department for getting me this information. This is monthly, the state of Georgia, and the next slide is going to be Dougherty County, the number of people who were partially and fully vaccinated. Both of these slides are going to tell us that by the end of April, you had approximately, well, in Dougherty County, we're going to have about a third of the population who are vaccinated. You see the numbers increase only incrementally until, and this is the state numbers, between July 31st and August 31st, when the numbers started spiking. In the middle of July, we had an increase in the number of people who were vaccinated. If you see between July 31st and August 31st, a full 5% increase in the number of people who were fully vaccinated. And finally, these are the numbers for Dougherty County. What is interesting is we almost plateaued at the end of April. There's an increase in the month of, on the fully vaccinated side, there is an increase of only 3%, is a substantial increase of about 4.5% on the partially. That's where the vaccination was finally opened up to everyone. It's an increase of only 2.1% from May 31st to June 30th. It was only 2.9% from June 30th to July 31st. The largest increase we have seen, and that again, it corresponds with that spike in July. We had an increase, a full increase of 6.2% in the month of August, which is double what you've seen in any previous month. Obviously, people were being motivated by the surge. Unfortunately, that has not carried on to the same extent in the month of September, even though there was some increase. I want to commend the county for this event that's coming up this Saturday. Encourage everyone who has had their first vaccination to come out for their second vaccination. It's my understanding there also will be administering the first vaccination to anyone who has not been vaccinated, and also want to commend the Strive for 75 campaign. I hope we see some increase there. As we have discussed in previous press conferences, the Strive for 75 campaign is directing its message to specific demographics because so many different groups in the community have reasons for not being vaccinated or even refusing to be vaccinated. But with that, I hope this was informative, and want to wish everyone a good weekend. Thank you. I don't fit. You got it, Mike? Thank you.
Yes, sir. All right. Thank you so much, Mayor Durr, for your update. We will now hear from Dr. Black. He is the Phoebe Putney Memorial Hospital Director of Emergency Services. Dr. James Black.
Thank you. Good morning. Give you some updates. Overall, our trend continues to move steadily in a positive direction, with the number of patients being hospitalized decreasing week over week. Today, we're caring for 58 COVID patients in our health system. That includes 51 patients here in Albany, 7 in Sumter, and 0 in Worth County. And that represents a 73% decrease since our peak in August, where we were up at 214, and about a 27% decrease since last Friday. We've also gotten some relief in our critical care units over the past couple of weeks. We're down to 18 patients in our COVID intensive care units, and that's a decrease of 40% from last week. 14 of those patients are on ventilators, and it's down 39%. And unfortunately, we've also lost 4 patients since last Friday. So most of those numbers are encouraging, other than the deaths, obviously, but we're seeing a decrease in number, and certainly we're happy to see any improvement. But I do want to caution not to get too excited, because although we're down to 58 patients, that's more than 7 times what we had when we had gotten down to single digits in 8 patients. So we're still in the midst of the surge, although the numbers are improving. And that's also in the face of we're coming up on more holiday seasons, and as well as football season, which is a great opportunity for people to get together. So I just don't want us to lose our momentum. I want us to continue to do those things that are going to help protect us. The number of patients we're seeing in our emergency departments is down as well, and the positivity rate for those being tested is also down. We're looking much better, and the transmission appears to be slowing in the community, but again, we're not finished. Since the last surge, or since this last surge began in July, we've admitted in our hospitals 1,008 COVID patients, and that average age of the COVID patients is 56. And that number represents a steep decrease from the average age of patients that were admitted with the initial outbreak of the pandemic. And we've seen that number continually fall, and it's telling us that people in the younger age groups are continuing to be infected. Also, not coincidentally, the younger the age groups, the lower the vaccination rate. So we think that the vaccinations are playing a big deal in keeping some of our more experienced citizens from getting sick, but it's also decreasing that average age of the people who are being admitted. The overwhelming majority of the patients that need to be admitted to the hospital for COVID are unvaccinated. Almost all of the patients that have been admitted to the ICU and then subsequently intubated are unvaccinated, and all but one of the deaths we've had in the most recent surge were unvaccinated. Again, all of these numbers that are just not happening locally, but you see them around the state and around the country, are telling us that vaccination is probably your best preventive measure at reducing the risk of hospitalization, reducing the risk of progression to serious disease, and reducing the risk of being intubated, and of course reducing the likelihood of death. Since the vaccines have been available, there have been 180-something thousand deaths from coronavirus, and of those deaths, about 1,400 were vaccinated. The rest were unvaccinated. So again, getting vaccinated puts you in a much better position in order to survive the disease should you become infected. We continue to urge people to get vaccinated. I think you saw we were ranked in the 40s as far as states that are being vaccinated. In Dougherty County, we have a 44% vaccination rate, which puts us below the state average and well below the national average. So we'll continue to press the, or put the message out that we would like for people to get vaccinated. Phoebe is going to help support Dougherty County's second Strive for 75 incentive-based vaccination event tomorrow. We have our mobile wellness clinics, and our vaccination teams will be there at Civic Center administering vaccines. And if you're a Dougherty County resident and who's not fully vaccinated, it's a great opportunity to help protect yourselves and those around you, and also get a $100 gift certificate. Today is also the last day we'll be holding our max vaccination site here in Albany. We reopened that site a couple of weeks ago when the Pfizer booster shots became available. The demand has decreased, so we no longer need our mass sites. But we'll continue to offer the first, second, or third doses at our clinics and mobile events throughout Southwest Georgia. And again, you can schedule those by calling 229-312-MyMD or 229-312-6963. And as a side note, we also encourage you to get vaccinated against influenza as flu season is coming up. And we're going to try to do everything we can to prevent a COVID and an influenza surge. And we have had patients that are having COVID and flu at the same time. So we certainly want you to get vaccinated and continue to be smart and protect yourself and those loved ones as we get through what we hope is going to be our last surge, or last major surge of COVID. Thank you.
All right, thank you, Dr. Black. Now we will hear from the Director of the Southwest Georgia District of the Department of Public Health, Dr. Charles Ruiz.
Good morning, everyone. We have heard some encouraging news this morning, and it's good to hear the facts that we've heard. Knowledge is power, and I agree with Dr. Black, who pointed out that we are still in this COVID surge, and it's way too soon to let our guard down, way too soon to claim victory. So in spite of the good news, it's our responsibility to also share the not so good news. And one thing we need to always keep our eye on is the number of new infections that are occurring in the community. And in Dougherty County, over the past 14 days, Public Health has become aware of 367 brand new COVID infections. So if you do the math, that's about 26 brand new infections in Dougherty County every day. That is a sign that that this is not a healthy community at this point. We still have lots of work to do. Some of those people are going to wind up going to the hospital. It's possible that some of those people are going to wind up losing their lives. So we ought to consider what we can do to reduce that number. Some people who are listening to this presentation today may be among the new cases that we report over the next week or two. We anticipate about 175 or 180 new cases between now and the next press conference next Friday. So we ought to consider what we can do to reduce that number. And if you are not vaccinated, you certainly would want to consider what you can do to help protect yourself. One of those things is social distancing. Whenever possible, if we practice social distancing, it reduces the chance that we will be the victim of a new COVID infection. If we have COVID, it'll reduce the chance that we would spread it to someone else. When we can't social distance, we can wear a mask, and that will help us to avoid becoming a victim. And then, of course, getting the vaccination is by far the top individual thing that we can do to protect ourselves from COVID infections. In the state of Georgia, 55% of people have decided that COVID vaccines are worth a try. 55% of Georgians have had at least one vaccine, and 49% of all Georgians are fully vaccinated. In Dougherty County, 49% have had at least one vaccine, and 44% are fully vaccinated. That's good, but we have more work to do. We hope that those numbers will continue to climb as time goes by. Testing is still an important part of our response to the COVID pandemic. If you've been exposed or if you have symptoms, it is a good idea to get tested. So we are offering free PCR COVID tests 7 days a week here in Dougherty County. I'm speaking of public health. There are other locations where you can get tested, but in public health, we offer this 7 days a week. It can be just a little bit confusing because we have two different locations. On Saturdays and Sundays, testing is offered at the health department on South Slappy. Those hours are 9 a.m. to 2 p.m. every Saturday and Sunday. South Slappy at the health department. You don't have to have an appointment, but if you want to pre-register, you might find that to be an advantage because it would reduce the amount of time that you would have to spend waiting in line. If you want to pre-register, one option is to call this number 844-778-2455, and you can pre-register. Once you do that, you don't actually have an appointment, but it allows our service to collect the data that we would need to process the test. And once you're pre-registered, if you have to return for a second test down the road, you're already in the system. Another way to pre-register is by using the QR code that you may be able to see on your screen right now. You could scan that with your phone and pre-register that way. That's Saturdays and Sundays. Monday through Friday, we are testing in a different location. It's just really down Slappy and around the corner on West Oak Ridge Drive. The Monday through Friday testing is 9 a.m. to 4 p.m. and you can call that same number to pre-register, but there's a different QR code. So if you're interested in maybe getting tested on Monday through Friday, this would be the QR code to use to pre-register. These are PCR tests. Usually the results are available in about 40 to 48 hours. So what we're hoping everyone will do is to consider the dangers that are in the community, and they are real. Consider what you can do to protect yourself, protect your family, and to protect the community. Thank you very much. Stay safe.
Thank you, Dr. Ruiz. Our final presenter today will be Sam Allen, E.M.S. Director for Dougherty County, who will share information with us on Dougherty County's second incentive-based vaccination event coming up tomorrow behind the Albany Civic Center.
Good morning. Thank you, Mr. McCoy. Tomorrow, Dougherty County will be sponsoring our second mass vaccination at the Albany Civic Center. This event will start at 8 o'clock in the morning and will end at 2 o'clock in the afternoon. We have a slide presentation. I'd like to go over some interesting information for you. Please, if you have not had the vaccine, if you are needing your second shot or you're needing your booster and you qualify for the booster guidelines, please come out tomorrow to get your vaccine. We will be located on the back parking lot of the Albany Civic Center. Again, the times will run from 8 o'clock in the morning until approximately 2 in the afternoon. We will be giving Pfizer only. If you have taken the first shot and you're needing your second shot, it has to be Pfizer. You can't cross, as they say, Moderna to Pfizer, Pfizer to Moderna, Johnson & Johnson. This is for Pfizer only. So please make sure you know, because we don't want you to wait in line all the way to the point to where you can't get the shot. So again, we will be giving Pfizer. The best way to enter the facility and the only way to enter the facility is through Front Street, South Front Street at West Oglethorpe. You will turn at the intersection. Washington Street, if you go down Washington Street, it will not be accessible to the event. So you come back up to Oglethorpe, turn on Front Street, head southbound to Mercer Avenue. From Mercer Avenue, you will be directed by staff on where to enter the second parking lot. What do you need to bring? You need your identification material. You need a photo ID, and you need to bring your vaccination card. If you've already had the vaccine, your first shot, second shot, if you're getting your booster, you still need to bring your vaccine card. The staff need to be able to see this and document on your card for your next vaccine. Please have your ID ready. Please have your vaccination card ready. Once you get to the back parking lot, you will be given some paperwork about the medication. You will also be given another document to fill out for your patient information. Please make sure that you complete both pages. There's 2 pages on it, so fill those out, please. And again, as I said, we will be giving Pfizer and Pfizer only. Once you come through the line, and this time we're increasing the volume, so the lines will not be nearly as long as they were the last time. It was something that we adjusted on this event. If you're a Dougherty County resident and you can show proof that you live in Dougherty County, you will be eligible for the $100 gift card age 18 and up. We will be giving children age 12 to 17 Pfizer vaccine. However, they are not eligible for the vaccine distribution. If you're from another county, please come get your vaccination. Unfortunately, we will not be able to give the distribution card to residents from other counties, but we can give you your vaccine. So please, again, if you're in a surrounding county, from 8 to 2 tomorrow at the Civic Center. We will have drive-through tents. We're going to have 2 tents set up with 6 lanes of traffic. You will be directed into which tent. You'll pull up, lower your windows down. An inoculator will come over. You present to them your card, your completed paperwork. You've already been checked through the Georgia Grits vaccination access to make sure that you're eligible. They will immediately give you your vaccine. And tomorrow, we have increased the size capacity, so we should keep the lines moving extremely faster. There will be a Dougherty County ambulance on standby. Once you get your vaccination, you'll pull to the other side of the parking lot for your 15-minute wait. If you have any problems, please get one of the staff that's walking around, blow your car horn. Medical personnel will come over and check you, make sure if you need medical treatment, you will get it right then and there. But I can tell you, we have been around probably close to 60,000 vaccinations, and we've only had 3 potential allergic reactions. Were they true? I don't know. They were taken to the hospital for observation. But again, 3 out of 60,000, so the numbers are relatively small, so please, come get your vaccine. Once you complete your 15-minute standby, you will then pull over to the finance tent if you're a Dougherty County resident. If you're a resident from another county, you can simply leave the parking lot at that time. But if you're a Dougherty County resident with proof of residency, you've completed everything, you'll present your vaccine card, you'll present your residency form to the finance staff, they will complete the paperwork, they will issue a $100 gift Visa card. That will also be drive-through tent, so it's going to make it quicker and faster. So again, the holidays are coming. They're getting very close. Thanksgiving and December put a hard hit on Dougherty County in January and February. Let's get the vaccine now. Let's take the vaccine. Let's make it a safer holiday season so that we can be with our families and we're not going into the hospital to see our families in their last few minutes. Thank you.
Thank you, Mr. Allen. Our last speaker will be Coroner Michael Fowler.
Good morning. I don't want to repeat everything that everyone else has said. I agree that the vaccination works. Right now, we at 365 death residents here in Dougherty County. So since last Friday, we've had 8 more deaths. So it's like 1 down a day. So people are still dying. So I want to encourage you, if there's anything positive that I can say. Last week, I made the statement that we want to go through the weekend, Albany State Homecoming weekend, without a death, homicide, a suicide, or drug death. I want to say congratulations. We did not have, since last week, we have not had a homicide in Dougherty County. We have not had a drug overdose in Dougherty County. We have not had a suicide in Dougherty County. One lady came up to me after the parade and said, Mr. Fowler, I told my son that what you had said, the same thing, and I told him the same thing. You need to listen to what the coroner saying about putting the guns down, about drug death too. So if I had something to say good today, you need to go out Saturday. If you have not taken the vaccination, go get the vaccination. It is so important. People are still dying. We at 365, and the trend that we're on, we're going to reach 400 before the year out. And you do not have to be a part of that number. So I encourage you, everything has been said, pay attention, and go out tomorrow. Get up, go get vaccinated. Again, thank you.
Thank you, Mr. Fowler. This concludes today's press briefing. Our next press briefing will be held next Friday, October 22nd at 10 a.m. We invite you to tune in, and please join us behind the Albany Civic Center tomorrow between 8 a.m. and 2 p.m. to receive your COVID-19 vaccination.
Join the Dougherty County Board of Commissioners on this Saturday, October 16th from 8 a.m. to 2 p.m. behind the Albany Civic Center for our second incentive-based COVID-19 vaccination event. During this event, you can receive your first or second Pfizer COVID-19 vaccine. And if you're a Dougherty County resident age 18 or older, you will receive a $100 debit gift card. Proof of residency is required. Are you a college student in Dougherty County? You qualify as well. Just be ready to show your valid college ID to receive the gift card. Our vaccination process is seamless with limited wait time, and while you wait, you can expect some entertainment with a live remote from JDiva with WJIZ from 10 a.m. to 12 noon, and constant music from DJ Jackson Riley with First Media Services. Drive up and walk up traffic are both available. We are striving for 75 in Dougherty County, which means we need to reach our goal of having 75% or more of Dougherty County residents vaccinated before we hit the new year. So join us this Saturday, October 16th from 8 a.m. to 2 p.m. behind the Albany Civic Center and be a part of Strive for 75 and help us to continue to protect our community from COVID-19. This event is brought to you by the Dougherty County Board of Commissioners in partnership with Phoebe Putney Memorial Hospital, the Department of Public Health Southwest Georgia District, and Albany Area Primary Health Care. For more information, visit dougherty.ga.us. Join the Dougherty County